What's the difference between trauma and post-traumatic stress disorder, PTSD? So trauma is an overwhelming experience for which we don't have the coping mechanisms to deal with, and that shatters our life. Now, for an event to be traumatic, it means that it's not just what happens to you, but it's what happens to you inside that is traumatic, that makes it very traumatic. It's how you react to it, it's the emotions that come with it, it's the lack of support that comes with the traumatic experience that makes it so traumatic. Now, that doesn't mean that you're going to develop a clinical syndrome or that you're going to develop a disorder because you have a traumatic experience. When we call post-traumatic stress disorder is the symptoms that come after 6 months at least of not being able to cope with a traumatic experience that doesn't allow people to function every day in life. Somebody with PTSD has a very hard time, a lot of difficulty going about their life because there's so many triggers around, and there's a set of symptoms that characterize what PTSD is, including nightmares, flashbacks, hypervigilance, numbness, lack of being able to work efficiently every day, not being able to sustain healthy relationships, and many other symptoms that qualify for a diagnosis of PTSD.